Okay, hello everyone, and welcome to the Evolution of Wellness program series. My name is Dr. Colleen Kachele, and your host today for the webinar titled Your Complete Guide to CBD. I want to first tell you a little bit about myself. I am a doctor of chiropractic and the owner of Back to Health Chiropractic Center in Ramsey, New Jersey. I am also one of the guides of the Wellness Inspiration with my friend and fellow chiropractor, Dr. Valerie Cardillo. The Evolution of Wellness program is going to be a series of webinars and podcasts that I am really just beginning now. My hope is that they are going to be informative, educational, and inspiring for you for your own personal journey to wellness. Wellness is definitely not a destination, but an evolution that I believe. And my goal is to help anyone interested in taking an active role in their own health or for their family with these webinars and podcasts. I hope the information today is helpful. And I am always open to questions, and you can email me at info@backtohealthonline.net. I'm going to be moving through some slides as we go through here, and I'm going to start with a bunch of information. I hope I don't overwhelm you. Take notes if you want. And as like I said before, you can always ask questions. There's a chat box that you can post questions in. Let's see if I can pull that up and I can see your questions. And now I did something that I didn't want to do. Oh, geez. There we go. Okay, everyone. So once again, I'm really excited to finally have this chance to actually share all these great benefits of CBD oil with you. I've been utilizing CBD oil in my office for a while with patients. And like I said before, if you want to put a question into the chat box, if I can just figure out how to go get it again. There it is. Okay. The use of CBD oil has actually been exploding recently, and you can actually buy it at places like Bed Bath & Beyond. I would not recommend that, but that's how hot a product it is right now. It seems to be everywhere, and we want to just make sure we're getting the right information. So that's why I wanted to give you as much information as I can from all the research that I've been doing, and let's see if CBD lives up to the hype. I'm going to let you decide for yourself, and I want to start taking a look first at the history of CBD. Then I'll explain a little bit more what CBD oil is, and then I'll end the class by sharing some benefits associated with CBD oil. So CBD oil does have a pretty long, rich history. Many people assume that it's just some new, innovative type of supplement. However, it's been being used for centuries. Roger Adams, a chemistry professor at the University of Illinois, first discovered CBD in the 1940s. Adams was the first to separate CBD oil from the hemp plant and to study its properties, and he found out they had a lot of health benefits. He also was the one to isolate THC, which is a psychoactive cannabinoid that gives you the high feeling from marijuana. Modern CBD history in the US additionally continued in 1946 when Walter S. Lowe conducted the first CBD test on lab animals. The tests were performed to prove that CBD doesn't cause any altered mental state like THC does. And further research continued in the 1960s on primates. And finally, the first CBD oil meant for therapeutic use was released by the British Pharmacopoeia. Research just continued over the next few decades, and another discovery was made in 1980 by Dr. Mechulam, who ran a study which showed cannabidiol, or CBD, would be a critical factor in treating epilepsy. And there is actually a pediatric drug that has recently been approved by the FDA to treat pediatric epilepsy. So there's a lot of research being done and a lot more that really needs to be done. So today, there is still some stigma around CBD, but it's starting to disappear because of all these benefits that are finally beginning to be understood. CBD supplements are made from industrial hemp, and it's legal to grow hemp in all 50 states in the UK and many other countries around the world. Hemp was classified as a drug until a farm bill was passed in December 2018, which made it now legal to process CBD for human consumption. To be fair, to make it legal, it has to have no more than 0.3% THC in the product. And in a very short period of time, it's becoming a booming business. So this is where the buyer beware is of a huge importance, and you need to know what you're buying, and that's another reason why I wanted to do this webinar. CBD companies are popping up daily. There are hundreds of companies, thousands of products. And where do you go? What do you buy? And whose advice do you listen to? So I do hope you take my advice under, advisement here and purchase products that are trusted sources. This is why I do so much research for the products I carry in my office or recommend to my patients. The product should have the full amount of CBD labeled on it. Whatever is in the product, that's what should be on the label, and giving you the total amount of CBD. You should also only use a product that will provide you with third-party testing. Those tests are called the C of A or Certificate of Analysis. If they won't offer you that, you have no proof of what you're actually buying or ingesting. You'll also want to try a product that is organic, as the standards for the farming of hemp, industrial hemp, are not quite set up yet. So you don't want to utilize products that are not organic at this point because we don't know what kind of pesticides are being used. Scientists are still researching CBD and conducting experiments that reveal all of its beneficial uses. So there's a lot of questions that people actually have is, what is the difference between hemp and marijuana? Let's kind of take a look at that now. To understand the differences between hemp and marijuana, we're going to discuss cannabis. So the cannabis plants is a part of a plant family that includes a lot of species, such as hemp and marijuana. Although they come from the same plant family, they have distinctly different purposes and uses. For example, cabbage and turnips are both different vegetables. However, they both belong to a plant family called the cruciferae family, or cruciferous vegetables, but they're very different vegetables. Hemp and industrial hemp refer to the strain of cannabis plant that is grown for agricultural products such as textile, seeds, and oils. Industrial regulation restricts THC in any CBD product to no greater than 0.3%. We're going to talk about THC more as we go on here. And marijuana, on the other hand, is known for its flowering plant tops. The flowers are bred to contain a high THC content, and the average content of THC contained in marijuana is about 10%. And the plants are illegal to grow without a proper license, and in only certain participating states can you actually grow marijuana. Hemp versus marijuana, a little bit further here. There are two simple distinctions between hemp and marijuana. Hemp is a non-psychoactive plant primarily for use in clothing, paper, biofuels, bioplastic, dietary supplements, cosmetics, and personal care products and foods. Hemp is cultivated outdoors as a large crop with both male and female plants being present to foster pollination and increase seed production. Marijuana, which is Cannabis sativa, is specially cultivated to enhance its THC content. It is used for medicinal or recreational purposes, as we all know. Marijuana plants are typically grown indoors and under controlled conditions. Growers remove all the male plants from the crop to prevent fertilization, because fertilization actually lowers the plant's THC level. The other thing that I've learned over a lot of my research is that from back years ago, THC levels in marijuana are really at a high level than they've ever been before. And they hybridize plants to make sure they grow, with more and more THC. So it's very different from the marijuana that we knew maybe when we were in our younger days. So THC and CBD are actually termed cannabinoids. So cannabinoids are all these chemical compounds, and there are other ones besides CBD and THC. There's more than 113, some people say 130 different cannabinoids that have been isolated from the cannabis plant. The best studied cannabinoids are tetrahydrocannabinol, which is THC, cannabidiol, which is CBD, and cannabinol, which is CBN. THC is this psychoactive cannabinoid found in the cannabis plant. And it does have other therapeutic qualities, which include pain relief, relaxation, appetite stimulation, and insomnia. We all know about the munchies, right? CBD or cannabidiol is present in many strains of cannabis at low levels. And some of the popular uses of CBD do include also relief from chronic muscle pain, convulsions, epilepsy, and seizures is kind of involved in that, and that's where that drug came from, and inflammation. CBN, or cannabidiol, is usually formed when CBN, which is cannabinol, is usually formed when THC is exposed to UV light and oxygen over time. And CBN has some psychoactive properties, but not nearly to the level that THC has. There's also a lot of research being done on CBG, which is cannabigerol, and its medicinal value over time. All of these hundreds of different cannabinoids over time will probably get researched and looked at in various ways over many, many years. There's a lot of research to be done. So you can buy CBD as an isolate, which means it only has CBD in the bottle. You can also buy full spectrum CBD oil, which contains CBD and small doses of other cannabinoids. And the other thing that's involved in a full spectrum product is various terpenes. Those are other organic compounds that increase the effectiveness of CBD. Speaking of a full spectrum product, there's a term that is used called the entourage effect that happens. So having different cannabinoids and the terpenes together allows everything to function better. They work better together. The endocannabinoid system, you may be surprised to learn that is actually a system in our bodies comprised of receptors that interact exclusively with cannabinoids like CBD. It's known as the endocannabinoid system. I'm going to say that again, endocannabinoid system. This is a long word, and it is the reason we benefit from CBD. The endocannabinoid system is made up of a network of receptors and was really only just discovered in the late 1990s, recently. So more research is being done with this, but endo means inside the body. So we have this system inside our body already set up to take in this information from cannabinoids. CBD bonds in our bodies with the endocannabinoid receptors, helping to maintain a lot of vital health functions and restore the homeostasis, which is balance within the body. When I explain the endocannabinoid system in my office, I really try to make sure people understand that the system isn't really treating anything. It only helps balance out other body systems. This is why doing research on CBD and other cannabinoids is really difficult, because it's hard to pinpoint what it's actually doing in the body. And this is another reason why so many people just kind of have, information that comes back of just basic feeling better, basic health, increases in basic health. It does help a lot of other processes in the body and disorders in the body, and we're going to talk about some of those. So I just want to stop for a moment and see if there are any questions. I want to see if I can open my chat box here and see if anybody said anything. Oh, Fred has said, thank you for the wonderful information. Thank you, Fred. Let's continue on. If there's no one other, there is this chat box, if you can find it in the screen, and you can type in a question. So let's continue on here. Nope. There we go. We're going to go back to here. So a learning process. Like I've been saying a lot, there are researchers that really have been doing a lot of work, but there's still so much more to learn about the benefits of using CBD oil. So in preliminary studies, there has been a lot of indicators that CBD may inhibit tumor growth, making chemotherapy more effective without harming healthy cells and tissues. It can relieve pain and inflammation, including chronic pain and cancer pain, can reduce nausea and vomiting, can lessen anxiety and improve the quality of sleep. It can fight viruses and viral infections. It can relieve the muscle spasms of multiple sclerosis. CBD has also shown remarkable potential in studies for its ability to lower convulsions, anxiety, inflammation, and nausea. It can lessen the psychotic symptoms of schizophrenia. And it can reduce or prevent metastasis in breast cancer and other types of cancers. So from here, I want to go to some more facts and maybe into some actual conditions and where information is leading us to believe about CBD and its health benefits. So let's start with some facts. CBD is not a cannabinoid that will get you high. That's THC. CBD can provide a natural method to care for a wide range of ailments, and we've kind of just mentioned a whole bunch of them there. CBD has become very popular in the medicinal community, and researchers from around the world have conducted countless trials and medical studies. There are so many of them, it's hard to kind of keep track of them. I'm going to offer, if anybody is interested, if you want, you can email me and I can let you know and give you a whole bunch of links to a lot of different research articles. Research has been done to really show how CBD has anti-inflammatory, antioxidant, antipsychotic, anticonvulsant, and antidepressant properties, which really does benefit a wide range of conditions. Research shows also that CBD can benefit up to about 50 conditions at this point. And of course, we don't have time to discuss all of them. So let's look at a couple conditions more specifically from the list that we've been going through. Probably one of the, it's first and second in my office for why people are interested in CBD is anxiety and depression, and pain and inflammation are the other ones. So there's just some research, and I'm going to just go over some of it that shows how it's helping people with anxiety and depression. There's an association called the Anxiety and Depression Association of America, which states that anxiety disorders affect more than 18% of the population. According to the World Health Organization, depression is the single most significant contributor to disability worldwide. That's a pretty high number, and anxiety disorders are actually ranked sixth. And more people are turning to CBD as a natural alternative to prescribed medications, which really do have a lot of side effects or possible side effects. And according to a survey published in Cannabis and Cannabinoid Research Journal in 2018, almost 62% of cannabidiol users report that they have used CBD to treat a medical condition, with the top three conditions being pain, anxiety, and depression. There's also a report published in the Journal of Neurotherapeutics in 2015, where scientists analyzed all this preliminary research and found that CBD oil shows promise in the acute treatment of conditions like generalized anxiety disorder, panic disorder, social anxiety disorder, obsessive compulsive disorder, and post-traumatic stress disorder. There's another study in Neuropsychopharmacology journal in 2011 determined that CBD may help alleviate social anxiety. So that's the anxiety and depression side of its effects. There are lots of research showing neuroprotective properties from CBD also. And they believe that CBD's ability to act on the endocannabinoid system and other brain signaling systems may provide benefits for those with neurological disorders. One of the most studied uses for CBD is in treating neurological disorders like epilepsy, which I mentioned earlier that there's a pediatric drug for that now, and also MS, which is multiple sclerosis. CBD has also been researched for its potential effectiveness in treating several other neurological diseases. There are some studies that show the treatment with CBD improved quality of sleep and quality of life for people with Parkinson's disease. Additionally, there's another long-term study where researchers gave CBD to mice genetically predisposed to Alzheimer's disease, finding that it helped prevent cognitive decline over time. And that's a huge thing, where Alzheimer's disease is a up-and-coming epidemic, probably going to pass cancer in the years to come, near years to come. Another benefit that's being shown is with heart health. High blood pressure is linked to a risk of a lot of other health conditions, including stroke, heart attack, and metabolic problems. Recent research has linked CBD with several benefits for the heart and circulatory system, including the ability to lower high blood pressure. And research has also suggested that the stress and anxiety reducing properties of CBD may be responsible for its ability to help lower people's blood pressure. Next, let's go on to pain. We're talking about pain a lot, and as a chiropractic office, I have a lot of people in pain in my office, inflammatory conditions. So that's one of the other reasons why a lot of people are utilizing it. And research is showing chronic conditions like fibromyalgia and arthritis have been the subject of many studies with CBD and pain relief. It's gaining a lot of popularity as a natural approach to pain relief these days. It's thought that CBD oil might help ease chronic pain because it's reducing inflammation. And anytime you have a pain in a joint problem like that, there is always an amount of inflammation there. So getting rid of the inflammation is a huge part of decreasing the pain. Some of the research is showing that the chronic pain it can help is from cancer, fibromyalgia, headaches, irritable bowel syndrome, lower back pain, migraines, MS, we mentioned before, neuropathic pain, osteoarthritis, TMJ, which can be really troublesome. Let's go on to another one here. How about weight loss? So while THC increases appetite, like I said earlier, we've all heard about the munchies with smoking marijuana or ingesting it. CBD has the opposite effect. There was a 2017 review of scientific literature regarding CBD, which found that weight loss was a common side effect when CBD was used to treat seizures in people. And there was a reduced food intake and weight gain in the rats, also in rat studies. Of course, more research is needed to understand weight loss benefits. However, this is kind of an exciting potential use, as weight gain and obesity are really considered the cause of many other chronic health conditions. So how about we talk a little bit about the types of CBD that are out there? There are many different types of CBD products, determining how you want to use them. And that's going to be what might be best for you. There are 3 categories of CBD oil. There's ingestibles, there's smokables, and there's topicals. Ingestibles offer the most variety. There's liquid hemp oils, there are CBD tinctures or CBD drops. These are usually held under the tongue and get absorbed in your mouth very quickly, and they start the process for your body even before you swallow it. CBD can be concentrated into a thick paste, and I actually had to look this one up because I hadn't found or come across this in my research yet, but this thick paste is called Rick Simpson oil. And this guy named Rick Simpson, quite a few years ago, created a really thick paste, and he used it to treat his skin cancer. So I think that's something over time that has grown to be a popular option for people. You can also ingest encapsulated CBD oil. So I just want to make note that when you do ingest capsules, they first have to go to your stomach and have to be digested before the CBD actually gets into your bloodstream. So you're not going to get as much CBD out of it, active ingredient, because it has to go through all that process first. One of the best ways is to use an oil or a tincture. There's also sprays and spritzers that you can kind of spray in your mouth and right under beneath your tongue. There's actually bottled water with nano-sized CBD particles. I've seen ads for beer that has CBD in it, CBD-infused gum. There's dissolvable powders that you can add to things, and they many times have other herbs associated. There's cooking oils like coconut oil, olive oil that have added cannabinoids. And then there's your typical edibles, brownies, gummies, cookies, candies. And a lot of people use that who are sensitive or don't want to smoke or vape. And vaping is another way to ingest it or type of product. We know there's a lot of controversy against this right now. There are people and kids that are dying from vaping. It's mostly related. I shouldn't say that. I don't know if it's mostly related, but they're, making it sound like it's the replacement for cigarettes. I'm sure kids are vaping CBD or marijuana pot besides cigarettes. But vaping is a very quick way to get it into your system. But at this point, I would not recommend it because it is not a safe alternative at this point. Who can take CBD is another question that I get a lot of. And there really are no contraindications for anyone. I find some really strict sites that might pull out some drugs, but pregnancy is one of the few things that is just the safe bet to stay away from, just because there's really no research in how CBD would affect the fetus, as the baby's growing. But when you go back to our list of all of those things that we've gone through, and here's just a few more that I'll mention that CBD actually does have some benefits for, and there's research that is being done behind it. Acne, ADHD, ALS, anxiety, bacterial infections, healing of broken bones, depression, diabetes, dyskinesia, epilepsy, heart disease, inflammation, irritable bowel syndrome. This one I like really good, a lot. Mad cow disease. I don't know. I have not looked up the research on that one. Multiple sclerosis, nausea, pain from neuropathic or chronic pains, which we've discussed a lot of, Parkinson's, psoriasis, rheumatoid arthritis, and actually today I just spoke with someone who is having great results with using CBD for her RA. And I want to go over a little bit about the dosing of it. And I want to make sure you understand that legally, CBD products should have the total amount of CBD in milligrams listed on the product, bottle, the package. And if it doesn't have the total CBD in milligrams, you can figure it out by, say you have a 4-ounce bottle and if you want to figure out how many, the CBD in each dose, you can take the 4-ounce bottle, say it says it's 150 milligrams of CBD, and you want to know how much is in each ounce, you could just take the 1,500 divided by 4. That'll give you like 375 per ounce. But every bottle should have listed on it, if it's a quality product, how much CBD is in each dose. So say you have a product, a bottle, a tincture that has 300 milligrams of CBD in it. And it has listed that it has 30 doses, so each dose should be 10 milligrams. Oh, I'm getting a notice that I'm running out of time, so we're going for it. If the CBD or dosing and how to kind of figure that out is in another way. So if you have a bottle that has 30 doses, it's a 10 milligram dose for each dropper full of the bottle, say. Some other ways to dose is to take 1 to 6 milligrams of CBD for every 10 pounds of body weight. So if a person weighs 150 pounds, they could, essentially use about 15 milligrams a day. You can increase that for the severity of what's going on, increase it more for severe pain or more involved condition or problem. In my office, I pretty much start everyone with a 10 milligram a day dose. They recommend that you take it at night before bed, because one of the only side effects really is relaxation and sleepiness. So in the beginning, when you first start taking it, you definitely don't want to take it in the morning if you have to drive or go to work, because you might feel too relaxed. And then you can increase up to twice a day with those 10 milligrams as your symptoms are alleviating. And if they're not the way you want them to be, you feel like you can get a little bit more, you can keep increasing your dose by 5 milligrams a day, until you attain symptom relief, maybe every week or so. There are a lot of suggestions from the Mayo Clinic for various types of illnesses. So there are a lot of very prominent medical clinics that are utilizing CBD and actually doing research and suggesting it and using it with their patients. So that's great also. And the usage of them, like I said before, we have tinctures and oils that can put under your tongue. You can use it topically. There are salves or muscle rubs that you can put directly onto certain joints where you might have problems. And when you do it, place it under your tongue. The oils, you want to kind of put it in your mouth, leave it there for about a minute before you actually swallow it, so it starts getting absorbed that way. The salves are really nice. There are salves that help skin conditions like psoriasis and eczema, or you can be using it more for a joint problem, inflammatory problem. So I want to go through some final notes here that might concern somebody. Is there a dose that's too much of CBD? Can I take too much? There is no established lethal dose of CBD, and chronic use, and I've read a lot of studies with people using very large amounts of it for long periods of time, has repeatedly shown to be tolerated by humans without a problem, as long as you're using a good quality product. And as with anything, you really should speak to your physician before you actually use it, and make sure that if there's any concerns about drug reactions, you can even talk to your pharmacist too. And like I said earlier, CBD is not physically, it's not psychoactive, but it's not physically addictive either. And if you want to increase the effects of it, eating it with conjunction of a diet high in omega-3 fatty acids also helps. And as with every person, Everyone is uniquely different, so everyone may use different doses, even members of the same family. And if you're under more high chronic stress, or you have more severe symptoms or problems going on, you're probably going to have to use a higher dose. But maybe over time you can lower that. So I want to just kind of reiterate again that if anyone is interested in any resources, or has any more questions about anything, I can absolutely, would love to hear. Let's see if I have any more questions going on. No, so nobody's asking me any questions. So I'm gonna kind of pack it in here. And I just want to say thanks for joining me today. And I hope you learned something from this that you can take away. And as I've always said, you can email me with any questions and that you have regarding CBD or anything else. In my office, in my practice, I carry a couple different products, and I always have things available for anyone. I could ship things anywhere also. Remember, CBD is effective, and sometimes along with your normal conventional medical treatments, and you should always talk to your doctor if you really have questions about any of that. So once again, I want to thank you for joining me, and I want to say thanks for being part of the wellness evolution that we're going on here, and I hope you join me again in another podcast or another webinar, and possibly a podcast in the future. Thanks so much.